If I were to ask you to bend forward and try to touch your toes, could you? Well, if you're not sure if your hamstrings are contributing to your inability to touch your toes, or even if you're not sure if you have tight hamstrings, this is for you because I'm going to take you through some quick assessments that you can do to help determine whether or not your hamstrings are tight. Now, it's important to know if you have tight hamstrings because limited mobility can increase your risk of injury, especially if you're doing more recreational sports activities. If you're spending a lot of time seated at your desk or sitting at home, then you probably have tight hamstrings. A lot of people don't realize that the sitting position itself can predispose you to have tight hamstrings. So, these assessments will help you determine if you need to be working more on your flexibility. If you have a low back pain or even hip pain, same thing. These assessments can help you determine whether or not your tight hamstrings are contributing to the pain that you're having. So let's go ahead and jump into these two easy assessments. And just so you know, we're going to take it to the ground for these assessments. But if you're not able to get safely on and off the ground, I'm also going to show you some modifications so that way you can still assess and determine whether or not your hamstrings are tight. If you're able to go into the ground, I want you to go ahead and sit on the ground in a seated position. But if you're not able to go into the ground, hold on because I'm also going to show you modifications that you can do for these two quick hamstring flexibility assessments. So first, seated on the ground, I'm going to have you straighten out one leg. The other leg you can leave bent either with the knee up or even bringing it down towards your side. Now, with you in this position here, you want to try to keep your back in an upright and erect position. You don't want to allow for the shoulders to roll forward or for your tummy to start to scrunch. As you do this, you're actually causing the pelvis to shift, which can decrease some of the tension placed on the hamstrings and give you information that's not completely accurate. So as you're upright in this position, you want to keep the knee nice and straight, keep the back straight and bend just at the hips. Now you're going to see if you're able to touch your toes and coming down. Now, if you're able to touch your toes, great. You may even notice you're able to go beyond your toes with your hand. If not, or if you notice a knee starts to bend or you want to try to roll the back, that's the indication that you could have tight hamstrings and you want to make sure that you're taking the time to stretch. Now, for the next assessment that you can do, we're going to have you lay all the way down on the ground. So with you laying here on the ground, we're going to have you lift one leg up and you're going to try to get the knee directly in line with the hip. So those should be in a straight line. You're going to place your hands behind your thighs and now I want for you to kick the foot up, trying to straighten the knee all the way. Now, if you're noticing that you're not able to straighten your knee, take note as to how straight the knee is getting. Because if you're only getting part of the way up, that could be indicative that the hamstring is tight. Now, there are some individuals who may have a little bit of tightness that's considered to be within a normal range, and they may not be able to come all the way straight, such as this. So they may have just a slight bend. Now, having a slight bend and a significant bend are two different things. So take note as to how your hamstrings feel when you do this, and if it's that nagging pull that you feel in the back of the thigh. So now that you're seated in the chair, we're going to perform the same motions that we did on the ground, but now in this position. So this is perfect for individuals who don't feel comfortable getting on and off the ground or who are not safe and able to do so. So what you're going to do is you're going to first maintain that same upright position that we talked about with the back because you don't want to allow for things to hunch forward. You're then going to take one leg and you're going to straighten it. Now, depending on how long your legs are, or how short I should say, you may have to slide to the front of your chair a little bit. Just make sure that you still keep your bottom on the chair because we don't want you falling out of it. So keeping the leg nice and straight, you're going to allow for the knee to go all the way straight. Keep the chest upright so that way you're not arching at the back and folding forward. And we're going to have you try to do the same thing that we tried when you were seated on the ground. And now you're just going to reach to see if you're able to touch your toes. And you're just going to take note as to how close to the toes you get. For the next modification where we had the hands behind the thigh on the ground, we're going to maintain that same position, but now seated. Keeping the back and the torso upright, you're going to place your hands behind your thigh. And for this one, you can sit back in your chair a little bit more. And now with the hands helping to support the thigh or even the back of the chair allowing to support, you're just going to try to kick the leg up straight so that way the knee is becoming straight and the knee is in line with the hip. Now, as you do this, if you notice that you're not able to straighten the knee out all the way, or even you start to roll forward to get the leg straighter, that's the indication that your hamstrings are tight and you need to work on improving your flexibility. So after going through those assessments, tell me, were your hamstrings tight? If you're noticing that you have tight hamstrings, don't feel like you have to get fancy and learn a whole bunch of new stretches, because the assessments that I just showed you, those are two different things that you can do to go ahead and start stretching. So yes, the test you just did, you can turn into an exercise. So now you're able to work on improving your hamstring flexibility.